Our first speaker tonight, folks, is Professor Jeff Laurent. We are delighted to have Professor Jeff Laurent here as our guest speaker. Professor Laurent is the Director of the Institute of Respiratory Health, Director of the Centre for Cell Therapy and Regenerative Medicine at the University of Western Australia. Professor Laurent has published over 300 peer-reviewed articles in international journals of biomedical research and was awarded the European Respiratory Society's Presidential Award for his contribution to lung science. Can you give him a massive, warm welcome?
Ladies and gentlemen, welcome and thank you for allowing me to speak to you tonight. I'm a researcher. Sometimes we sit in labs and play around and do experiments. These evenings are inspiring for us as well, and to hear Willow, our presenter at the beginning of the evening, speak, to hear that wonderful song by Matt Scales. I mean, these are very inspiring things for us researchers to hear about. So thank you for giving me this opportunity to hear that. As Dwight Pedlow said at the beginning of the evening, Conquer Cystic Fibrosis has teamed up with the Institute of Respiratory Research. We're very proud of this combination. We think it's going to be very powerful. And both our aims are the same, and that is to conquer cystic fibrosis and find a cure. And thank you for all your support in that. I'm the director of the Institute of Respiratory Health. We have a wider brief. We want to help all patients that suffer from respiratory diseases. But cystic fibrosis is a dreadful disease. It's a curable disease. And we need help to solve it. We need help to cure it. But believe me, we are working very hard, not just in WA, not just in our centre, but worldwide. It's a world effort, and we're working together to solve this disease. I just want to tell you a slightly personal account of my first encounters with CF. I was the head of a biochemistry centre in London at the Brompton Hospital, and I was training for the very first London Marathon. It's quite a few years ago now, and I was a bit younger. And we had one of our patients running in the London Marathon, running in the same London Marathon. And so her and I teamed up, and she was a cystic fibrosis patient. Now, let me tell you, she was a very good runner. She was a national athlete in Great Britain. So this was a very one-sided team. She was the talent, and I was the guy that she dragged along. But, we really helped each other. We ran that London Marathon. She stayed with me for the first 3 quarters, and then when she turned to me and said, "Jeff, do you think you're going to make it?" And I said, "Yeah, I'm going to make it." And she said, "Well, in that case, I'm off. I want to do a better time." So she headed off and came home in 3 hours, 35 minutes. I was much longer than that. But, I mean, she was my hero. I tell you, she was an absolute star. And I've never forgotten the story of her bravery and her courage. I would tell her all about the research that was going on. We'd just discovered the CF gene about that time. It was a very exciting time. And we had hopes that by now we would have cured this disease, but we're still fighting on. When I was there, my research area was in stem cells and trying to regenerate lungs. This is not a time to give you a detailed research account, but I just try and give you some idea of the excitement of that. What a wonderful thing it could be if we could regenerate a lung. Regenerate a lung free of the disease that is plaguing the patients with these many respiratory diseases. So in those early days, I was trying to find the stem cells and the cells that drove lung regeneration. We knew that we could do that in experimental animals, but we didn't know that we can do it in man. We still haven't done it in man. We've still got a way to go, but what we can do now is we can regenerate a lung or a something that looks like a lung that does exchange gases. Now, that's a long way to go before we can create a lung that we can use in a person, but I think it's just a matter of time before we, via stem cell research and regenerative medicine, have some really creative ways to treat respiratory diseases. That's not the only approach we're taking to cystic fibrosis, but that is one approach at the Institute of Respiratory Health that we're taking. So, well, what can we do for cystic fibrosis, and how is this team that's been described going to help cystic fibrosis? Well, let me say first of all that we are in WA lucky to be very strong in respiratory diseases. We have some centres here that are world class, and just to give you a sense of how we sit in Australia, we attract about 1/3 of the NH and MRC funding in respiratory science to Perth. So we are already strong in Australia. We're strong in many areas, including cystic fibrosis, but we have a long way to go. The government funding, sadly, is not covering everything. It helps, but it's just a start. And so we recognise that we have a long way to go. So what are we going to do in this partnership? Well, I think you got the message that it's going to be a team. We're going to start from grassroots up. We want to attract young PhD students. We want to attract young medical fellows. We want to attract physiotherapists and other people involved with the treatment of respiratory diseases, including CF, in as fellows doing research. So you've had several messages today. There was a message in that last film, research is the key, and we all believe in our centre that research will be the key to crack this disease. But we must involve all people. This is not just something that happens in a lab. This is going to be something that happens with a team of people. That's a small beginning, but we believe once we attract those people, once we start to build teams, I've seen it happen before in many areas. I saw it happen in London. Once you get a talented team of young people, they build up, they grow, they get to a point that they can start running teams themselves. These things grow, they're organic, and I think in WA we're in a position to do that now. And I believe if we can get that going through the help of Conquer CF, we will also attract the very best people to Perth to work in this disease. We'll attract top doctors to Perth, we'll attract top scientists. I believe our institutions, the universities, the hospitals, will also recognise that excellence, and it'll snowball so that we will get more funds and more people working on this important disease. So I think I've said enough. I want to thank you for your patience in listening to the research side. Believe me, we're as determined as you are to try and eliminate this disease, conquer CF. We feel this is a dream team that we've set up and that has a very strong future. You have the commitment of the Institute of Respiratory Health, myself, my Deputy Director Peter Eastwood, my Clinical Director Gary Lee, and in the CF team here, we just think we have the best team ever. We look forward to the next 5 years. Thank you.
Thanks very much, Jeff. Appreciate you being here tonight, and appreciate you making me look bad by not having any notes at all. Terrific. Folks,